Hi, Dr. Goller here. And most of the country's in lockdown at the moment, and while we know that these restrictions will save lives, it's undeniably challenging for everyone, with a particular impact on our children. Two really important papers have just been published, and I just wanted to take this opportunity to shed light on them, to talk about them, and both of them will be linked for you on my Instagram for you to read in your own time. The first is a study from the University of Calgary last week, where they pulled together 29 different papers from all across the world looking at a combined 81,000 youths, and found that rates of anxiety and depression have doubled. That's doubled in children and adolescents compared to before the COVID pandemic. The numbers are astonishing, and there's no question that the COVID pandemic has dramatically changed the lives of children and adolescents the world over, in addition to the obvious stresses facing families like illness in loved ones, bereavement, unemployment, and the resulting financial strain. Children imbibe all of these, in addition to the sudden loss of structure that they really crave, their routine, their social interaction, and ultimately their sense of control. Even when not in a strict lockdown, social distancing guidelines, they've completely limited our children's contact with friends, with cousins, grandparents, and teachers. It worsens isolation, it worsens feelings of loneliness, and it's having a huge impact, not surprisingly. When children are faced with stress, we also know that schools do a wonderful job in providing resources to counter this. Things like supportive social interactions with peers, physical exercise, consistent meal times, and a structured routine. But these are lost with school closures and with online learning. We need to take this into consideration. And even in this very room where I practice, I've seen at least a 30% increase in the number of referrals that I'm seeing for mental health problems, for deliberate self-harm, for poor sleep, bedwetting, tics that have never been there before. The list sadly just goes on and on. But it's not all doom and gloom. I really wanted to focus on that. There are a number of simple, practical steps that families can take. These things promote resilience against mental health problems in children. And that's where the second study comes out. It was just released yesterday out of Harvard University, and the findings, they're very straightforward. The best things you can do: have a structured daily routine, limit non-educational screen use, spend more time in nature, and get the recommended amount of sleep. Finally, the strongest association for happier children at this time is to limit screen time use and news media consumption. Don't talk excessively about the pandemic in front of kids, the lockdowns, the numbers, the outbreaks, the variants. Just create a happy little bubble in your home where your children can escape all the noise and the pressure and the stress and live in your own little private wonderland. And who knows, it might just improve the mental health of us parents as well. So stay safe, stay strong for your children, and please try and smile as much as you can.